The second part in the pages of general anesthesia is maintenance. So we have stated that sedation, actually we start it from the IV, but maintenance is always with inhalational agent. This is MCQ. Sedation will always be with the IV agents, like we have studied propofol, and the maintenance is with the inhalational agent. Maintenance is always with inhalational agent. So the most commonly used inhalational agent, we have studied that it is sevoflurane. Sevoflurane is the most commonly used inhalational agent, and always remember a mixture of inhalational agent. How you will maintain the general anesthesia, you will maintain by giving a mixture of inhalational agent plus oxygen plus nitrous oxide. Always remember, mixture of inhalational agent plus oxygen plus nitrous oxide. So this is MCQ. Why we use nitrous oxide is a maintenance agent? Always remember, it has a good analgesic property. Nitrous oxide has a good analgesic property, and the need or requirement of the inhalational agent decreases due to its sedative properties. Always remember 2 points with the nitrous oxide. Number first one, it has analgesic properties. And the second one, it reduce the requirements of the inhalational agent. It reduce the requirements or need of inhalational agent like sevoflurane. But the side effects of the nitrous oxides are nausea and vomiting. Nausea plus vomiting. These are the post-operative side effects, are the post-operative complications of the nitrous oxide. The muscle relaxation, we have studied that, is maintained by the atracurium. But during the maintenance, we will have to manage so many things. Like we have to, there should be a qualified anesthesiast. Number first one, these things should be monitored, and we should monitor the vascular system. Vascular system means the BP of the patient should be managed with time during surgery or during anesthesia, and the ECG of the patient should be managed, and these both are showing by a monitor attached with the patient. And the third one is adequate ventilation. In adequate ventilation, we will have to check the 3 type of things: oxygen saturation. Second one is pulse rate by a pulse oximeter, and the third one is carbon dioxide. Concentration should be managed, because a high concentration cause a hypercarbia, and may lead to high carbon dioxide concentration, may lead to respiratory acidosis of the patient. So these things should be managed during the anesthesia or during the maintenance of the general anesthesia. The fourth one is central venous pressure. We also called CVP plus central venous pressure plus urine output. Urine output should be managed, but these are actually managed during a major surgeries, not during a minor surgeries. During major surgeries, the central venous pressure plus the urine output should also be managed. And always remember, the CPR facility, cardiac pulmonary resuscitation facility, should always be there. should always be there, because maybe the patient may go into the oxygen crisis, like we can say the hypoxia. So the cardiac pulmonary resuscitation facility should always be there, should be there. The third phase in the general anesthesia is reversal phase, or we can say the recovery phase. Reversal or recovery phase. In reversal or recovery phase, what we will have to do? The first step is to stop the induction agent. Stop the induction agent. What is induction agent? Propofol. Stop the induction agent, or we can say stop the propofol, because this is a stage of recovery. But always remember, the oxygen should be given regularly. Also in reversal phase. The third one is we will give acetylcholine esterase inhibitor, which is called newstigmine. Newstigmines drugs should be given. This is acetyl esterase inhibitor, and what is the function of newstigmine? It increase acetylcholine. And what will happen when the acetylcholine increase? It will reverse the relaxation. Reverse the relaxation means contraction of the muscles, because it is recovery phase. The fourth one is you will give atropine. What is atropine? It is actually muscarinic receptor blocker. So it will block the muscarinic receptor. Plus it will decrease the secretion. It will decrease the mucus or different substances secretion. And you will remove the endotracheal intubation. Remove the ETT, endotracheal intubation, and the final step is suction. To avoid any fluid flow to the airway. If suppose they are trapped any type of fluid or food, whatever, so you will do suction process to avoid fluid flow to the airway, trachea, bronchi and lungs, etc.